And you say that right now that there's like funding to prepare for something like the pandemic, and you say it's maybe 20% of what it needs to be.
Yeah, I might even say even less. When I was CDC director, I went down, I had an original budget of a little over $5 billion. And I was arguing that CDC's budget should be closer to 25 billion, realizing that CDC provides most of the public health funding for Tennessee, California, all the states. Most of the money, if you look at what your state provides in public health funding, you'll find it actually comes from the federal government through CDC. So, and we don't have the manufacturing capability. Luckily, we've had a scientific breakthrough with the mRNA vaccines where we can make a vaccine now in 2 to 6 weeks, whereas before it would take us 6 to 12 months. But we don't have the manufacturing capability if we do develop that vaccine. There needs to be much more attention to developing what I call private-public partnerships for pandemic response, very similar to what we have in the Defense Department, where we have long-lasting private-public partnerships to make sure that they have the defense requirements that our nation needs. That's how serious this is. And, you know, I'm still hopeful that people will get serious about giving a proportional response. When I used to testify before Congress, I'd say, you know, I want you to give me 3 to 5 aircraft carriers. Now, I don't want aircraft carriers, but I wanted the funding equivalent to it. So this nation needs to be investing more like 25 to 50 billion dollars in a year in its public health preparedness. If there's any real message here, we do have the capacity to get prepared. We are not prepared. And I ask people if they think this might be an overreaction, I ask them to read a book called The Great Influenza by John Barry, and it describes the influenza outbreak at the turn of the century. And you see what happened. Yeah. And don't kid yourself, that could happen again. Bird flu is going to have a mortality rate that is going to really have the potential to cause societal disharmony. When children start dying and teenagers start dying and, you know, adults in their 20s and 30s and 40s start dying, it's going to be very disruptive.
Gotcha.
Yeah, you know, I think the appropriate analogy is sort of to climate change, where we talk about we're all familiar now with the 1 in 200 year flood and the 1 in 300 year snowstorm, and we're having those more and more frequently. And this is a 1 in a 100 year pandemic, but I don't think it's going to be 100 years before we have another one. I think for a lot of global reasons, we are positioning ourselves to have another pandemic later. I want to piggyback on one thing that Dr. Redfield said, though, is that we need to apply the lessons, and those lessons include taking politics out of this, because the politics are even impeding us from learning those lessons. I think we've gotten some clue to that even here. I just think we have to have a better, more reasoned response that is politics agnostic.
Well, and I think it starts with A, being honest, and 2, like putting the children first here. And right now, it's going to start with more time in school, and that takes more money to close this gap, right?
Mm-hmm. Yes.
And that's going to take a lot of money, and it's going to have more time in school. Final comment, and we have to go.
Dr. Phil, I want you to know that it's really important that we go at this differently. The government has now put a ton of money into schools, but that money ends in 2025. So all of us who are superintendents are worried, because if we make systemic changes, but then don't have any money in 2025, it's going to be over. And we can't go back to having to say, oh, well, the teachers have to be responsible for the mental health crisis of the kids. Oh, well, the teachers have to make sure that the kids are vaccinated. We need to have health professionals. We need to have mental health professionals, especially on our campuses. And that means major systemic change is in our schools. It can't be this short-term thinking.
Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.